septorhinoplasty or a rhinoplasty procedure is also known as a nose job. Commonly, it is performed to change the way the nose looks as part of a cosmetic procedure, or it may be aimed at changing the way the nose works to improve the breathing through the nose. For patients who are considering having septorhinoplasty or a nose job, they can be divided usually into one of three categories. First, patients who are looking to make a cosmetic change only. Second, patients who are looking to improve the way the nose works in terms of breathing only. And third, patients who are looking to combine both. Patients who are having cosmetic surgery, there are usually three aspects that they are looking to change. First is a profile view, if there is a bump that they wish to take down. The second can relate to a twist or a deviation in the nose, which makes it lean to one side or the other. And the third is an operation that's aiming to change the shape, the size, or the orientation of the nasal tip. For patients who are having this procedure purely for functional reasons, it is often because they've had previous trauma or have a significant bony as well as septal cartilaginous nasal deviation that means that their nose needs to be broken and realigned in the midline to improve their breathing. It is always important to consider the alternatives to having an operation. For patients who are wanting to make cosmetic changes, they may choose to go down a temporary cosmetic filler route, although this is associated with its own complications. Or patients who have only got problems with their breathing may want to consider non-surgical treatments for blockage of their nose, like nasal stents or nasal breathing strips. There are two main types of septorhinoplasty procedure, the open and the closed. The open procedure differs from the closed operation in that it involves placing a small cut at the base of the nose, leaving a tiny scar. For patients who have closed septorhinoplasty, there is no incision placed on the face so that there are no scars visible after the surgery. The main reason for choosing one operation over the other is determined by your surgical assessment, and for patients who are having revision surgery or have very complex significant nasal deviations, or who are undergoing tip as well as work to the dorsum, which is the hump area of the nose, the open approach is often preferable. For patients who are only having work performed on their hump or do not have significant or severe cosmetic changes that need to be made, a closed approach may be more suitable. This is something that will be discussed with you in detail at the time of your assessments, and you're always welcome to ask more questions about this if you have any. During a septorhinoplasty procedure, the cartilage, which is in the midline that forms a septum, may be removed, reshaped and reinserted to help give a straight, stable baseline and to help the nose to sit in the middle. If the nasal bones are enlarged or if they are deviated to one side or the other, they may need to be shaved down either with a chisel or they may be rasped down with a fine file that we use. The nose may need to be broken and aligned in the straight position, and this may depend very much so on your personal circumstances. For some patients having cosmetic surgery to their nose, it is necessary to change the structures of the cartilages in the nasal tip. Depending on an individual's size, orientation, some cartilage may need to be added in the form of grafts, or some cartilage may need to be taken away or overlapped to help reduce the size of the nose or the orientation of the nasal tip. Depending on the type of operation that you're having and your skin type, there may be some changes to the skin or some stiffness after the operation that will take some time to settle down. Septorhinoplasty can be a very rewarding operation for patients as well as for their surgeons. Some of my happiest patients are the ones that have had septorhinoplasty both for functional and cosmetic reasons. It helps to improve the way their nose looks, boosts their personal self-confidence, and also helps to improve their breathing, which can have a positive impact on their sleep and exercise and many other aspects of their life. Septorhinoplasty is considered one of the most difficult and challenging procedures in all of facial cosmetic surgery. For this reason, there are many risks, and there are some risks that all patients face, and there are some minor risks that you should expect and be aware of and prepared to face if you are deciding to have this operation. All patients after the operation will have some pain and discomfort, and the nose will usually feel blocked and stuffy before it feels better. Often there is some packing placed inside the nose, which can make it difficult to breathe for the first few days. This needs to be washed out with a saline rinse and often with some antibiotic cream, which is placed in the nose. When the packing comes away, the breathing usually slowly improves over a few days and weeks. If your nose is broken as part of the procedure, it is very normal to have bruising and black eyes. This can last for a week to two afterwards, and can cause some swelling of the face, and is something that you should be prepared for. Because this operation involves breaking the nose, you should expect to have some blood-stained discharge from the nose for the first few days and possibly even the first 2 weeks after your operation. There is a small risk of an infection after this operation. For this reason, all my patients receive antibiotics during their surgery, and a large proportion will receive some antibiotics after the surgery to help prevent an infection. This is particularly the case in patients who have had a significant amount of tip work or if grafts have been placed inside the nose. After the operation, your nose will always feel a little stiffer than it was. If you have an open procedure, it will certainly feel numb in this area and in the upper lip. This can take a few weeks to a few months to settle down. There is a 1% risk of developing a hole in the nasal septum. This is a communication between the right and the left nostril. In most patients, if this happens, it's usually far back in the nose and patients never notice. But if this does cause you problems with crusting or whistling, it may be something that we need to address with a second operation in the future. At the end of the operation, the cartilages and the bones are usually placed in a straight midline position. For some patients, up to 5 to 10%, there can be some delayed changes, scarring or uneven healing. This can lead to irregularities in the color of the skin, causing some redness or pinkness, or can cause small bumps or lumps to appear on the nose during the healing period. It is important to remember that the septorhinoplasty takes 1 year to heal after the time the operation has been completed, and so anybody who has this surgery has to be prepared to be a little patient. For most patients who have septorhinoplasty, they tell me that the recovery is not as bad as they were expecting. Most of them will have some bruising, and everybody will need to take at least 2 weeks off from work or from their studies to rest and recuperate at home. Any strenuous activity during this time, for example exercise or heavy lifting, can precipitate significant nosebleeds, and this is something that we should always try to avoid, as it can affect the quality of the outcome in the short and the long term from this operation. Most patients would need to take paracetamol and ibuprofen regularly for the first week or two, with codeine in the first few days after the operation to manage the pain. For those of you that lead an active lifestyle, it is important to try and rest and avoid going to the gym for the first 2 to 3 weeks, but after that you can start gentle exercises, and by 4 weeks you can do most exercise, including swimming, if everything is healed very well. For some patients who have had an open septorhinoplasty procedure, there will be some non-dissolvable stitches which are placed in the incision site under the nose. Occasionally, some patients may also have some splints, which are blue silicone dressings that are placed inside the nose as well. These would need to be removed at 1 to 2 weeks after the surgery, and I would do that for you in the outpatient clinic. Remember, if you have this operation, you need to be patient. It's not unusual for a few small lumps or bumps or skin changes to appear after the operation, and it does take a year for things to settle down. I hope that you found this video informative, and if there's anything else that you need to know prior to your surgery, please do not hesitate to get in touch. This video is to help supplement the information that you've been provided in writing in your letter, as well as the leaflets that you've been provided with regards to septorhinoplasty.